Hi, my name is Crystal McKinney, and my case study analysis is on understaffing caused by COVID-19. Hi, my name is Crystal. The hospital that I work for is Riverside Regional Medical Center. They opened in 1916, but with a different name and in a different location than today. Riverside is a level 2 trauma center. They treat patients of all types, but if the patient is too much of an emergency, the patient will be transferred to another hospital with a trauma 1 status. Riverside currently has 2,205 full-time employees and 60 full-time contracted employees. There are 576 licensed beds and 327 staff beds within the main hospital. The Riverside Health System has several outlying health facilities. Riverside Diagnostic Center is in Oyster Point, Newport News, Virginia. It is one of the many imaging facilities that is operated under the main hospital. The Diagnostic Center provides many testing procedures, including mammograms, MRI, X-ray, fluoroscopy, CT, blood lab, ultrasound, and soon to be echo. The Diagnostic Center currently operates with 2 radiologists on site. The first radiologist assists with reading mammograms and doing procedures such as biopsies, while the other radiologist does diagnostic exams and such as fluoroscopy and reads CTs, MRIs, and X-rays. Since 2013, there's been very little change in staffing within the Diagnostic Center. Since the start of COVID-19, there's been many staffing issues due to staff burnout and callouts due to COVID-19 related exposures and illnesses. Understaffing has become a major issue within the Diagnostic Center and at times has put patient care in jeopardy. Rectification of understaffing must happen at once before someone, whether it be staff or patient, gets seriously injured. COVID-19 stands for Coronavirus Disease 2019, which was discovered in December of 2019. It is caused by the virus SARS-CoV-2. There are many symptoms of the virus, but the main symptoms are respiratory related. It is spread quickly through droplets that are projected from someone's nose or mouth while talking, coughing, sneezing, or breathing. Since the virus is very transferable, it spreads quickly from person to person. Many people are getting sick at once. This can cause serious problems with staffing within the medical field, causing much stress to the employees. Onto the main issue of staffing shortages. According to the CDC, one must quarantine if they've come in close contact within 6 feet for a cumulative total of 15 minutes or more over 1 day with someone who is positive with COVID-19. In the medical field, since employees are working very closely with possible or probable positive COVID patients, it is quite often, especially in the beginning of the pandemic, when an employee had to quarantine since there were no vaccinations yet. Since these employees have mandatory quarantines, they're not present, causing the department to become shorthanded. This poses a problem because it increases an individual's employee's workload, plus compromises patient care since there are less staff to take care of these patients. The mandatory quarantine does change, however, if one is fully vaccinated. Those who are vaccinated do not have to quarantine unless they are symptomatic, but do need to test 5 to 7 days after exposure and continue to mask in public for 14 days after exposure. Since the vaccines have been released, it has helped somewhat with the employees' quarantines, but burnout from trying to keep up from the previous absences still remain. As mentioned before, there has been several callouts and mandatory quarantines. These absences have created more of a strain on the existing employees that show up for their shift because there is greater workload on their shoulders. Since these employees are burnout, there is more of a chance of call outs and resignations that has been increasing in numbers lately. Call outs are resulted from many things. Lately, it's been from actual sicknesses. If an employee is sick, they must get tested for COVID and wait for the results, which may take days. Even if it is the common cold, there are symptoms that could mimic COVID. On day 2 of having the cold, the employee may be feeling better, but they don't have their results back. So it's going to keep them out of work for several days for basically nothing if they're negative. Also, employee burnout is happening as the struggle of understaffing stays at the forefront. Employees may be too tired to go into work because of the burnout, creating more gaps to fill within the department. So in summary, Riverside Diagnostic Center is facing a staffing shortage due to COVID-19. Patient flow has remained the same, except for the first 2 months of the pandemic. The absence of the employees creates an unsafe environment for the patients and increased wait times and decreasing patient satisfaction. Employees are burnt out due to picking up more work and having less staff on hand, creating an even bigger gap due to resignations and more call outs. Some evaluations to take into account on employee availability and coverage. So employee availability is a large factor in deciding how to rectify staffing shortages. There are staggered time slots that would need to be covered if the facility were to stay open the full amount of working hours. It wouldn't be easy to spread the existing employees out while waiting on a solution to the problem to come about. Budget is a big evaluation. The solution for staffing needs to be budget friendly. Implementing change should be kept steady and under normal routine and not add too much of an additional expense. Luckily, there is a flexible budget built within Riverside Health System. So a flexible budget does consider there are going to be fewer patient volumes within a certain range, and it can be adjusted as needed. Although there is a flexible budget, it still needs to be kept in mind that there needs to be a range to stay within. Going too far under the range can cause terrible consequences to the organization. Coming to the first alternative, which is shutting down a department. Since there's an issue with understaffing, this alternative involves shutting down the X-ray department. Currently, the X-ray department brings in the least amount of money. Taking all of the employed X-ray technologists within the diagnostic area and spreading them out to other departments so they can help, other modalities may help. For example, one diagnostic X-ray technologist will go with an MRI technologist. They're going to walk their patients back, go through their questionnaire form, and bring them to the MRI technologist when the patient is ready for their exam. When their exam is over, the diagnostic technologist could take the patient back to the dressing room and walk them to the door with the discharge instructions. This gives the MRI tech time to focus on the patient when it is needed the most, which is during the exam. The positive aspect of this alternative is the MRI technologist can take their time getting the patient on the table, offering them comfort items such as a warm blanket or a pillow under their knees. This help will allow the technologist to focus on the scan, reconstructions, and any charting that needs to be completed. This conquers many problems. Patient care would not be put at risk because the MRI technologist is not rushing to get through the next patient. They could always keep an eye on them. This would help prevent burnout on the technologist as well because they can take their time and not be spread thin. One negative to this alternative would be the obvious, which is shutting down a whole department, which does take away from the budget. Even though X-ray is not a huge moneymaker for the facility, it still brings in revenue. Another possible negative would be if a patient came all the way to the diagnostic center and had to be sent away. This may upset them. There is a chance for the patient to go to another non-Riverside facility, and the organization could lose their business altogether. The key to helping preventing that from happening is posting on the website and also calling around to let doctor offices know that there is a temporary shutdown of the X-ray diagnostic department so they can send their patients to another Riverside diagnostic center closer in another location. Alternative number 2 would be changing the office hours, shortening them. Currently, Riverside Diagnostic Center is open from 7:30 a.m. to 6 p.m. There must be shifts that are staggered to cover the opening time to the closing time. This may be one reason there are not enough staff to cover all the shifts. The morning technologists are by themselves for longer, as are the evening staff. This is leaving one tech by themselves for an extended period of time. Since they don't have anyone to help, this puts the patients at risk, especially if an adverse event happens. This will also help with patient safety. A patient, an MRI or CT, for example, get injections of contrast. If the patient has a bad reaction to the contrast, it is helpful to have a second person present to allow for notification of the medical emergency response team. And the patient does not have to be left alone. Also, having several patients on a work list being alone is very stressful. Stress and workload are some of the factors relating to staff burnout. There are positives to shortening the facility opening times. Shortening the office hours may help with staggered shifts. Eliminating these staggered shifts will allow for the proper number of technologists to be present within a department. This will increase patient safety exponentially by doubling or tripling the amount of people there to help if an adverse event were to happen, such as a contrast reaction. There may be an increase in patient satisfaction as well, because they would not be waiting as long to get their test completed if there are more employees available to complete their study. The staff will be very happy to have resources needed to complete their tasks safely and effectively. There will not be as much stress as they would on their daily workload, because it can be divided among the team. There are some major budgetary cons to this alternative. The hours being cut will take away approximately 2 MRI scans, 4 CT scans, 2 to 4 ultrasound studies, about 10 mammograms, and many walk-in lab and diagnostic X-ray exams. The budget would take a large hit as shown in the chart. The facility would lose about $13,000 per day. This loss would add up very quickly, and this alternative is not likely going to be the choice. Alternative number 3 is to hire more staff. There are too few staff, which is contributing to the issue at hand. Hiring more staff would be a great long-term alternative compared to the other options. More staff, even if they are PRN, would be very helpful. PRN staff would not be as expensive to keep within the company due to non-eligibility of benefits. When they're not needed, they are only guaranteed 16 hours a month. So they wouldn't have to be on staff all the time. And then when they are needed, they can fill in the gaps within the schedule. The positives of this alternative, including covering shifts when full-time staff cannot make it to work for illnesses or mandatory quarantine. This option allows for a long-term solution rather than a temporary Band-Aid. Hiring staff is not something that is done for a temporary time unless they are contracted. Contracted employees typically cost the organization more money, therefore the employees must be hired PRN help in order to keep the budget at bay. They may stay on for a long period of time for the possibility of a full-time work to open up. The ultimate positive is better quality patient care and happier employees. The more employees on hand, the less time a patient must wait, resulting in possible patient satisfaction increases. Employees that are happy care more about their job and will put more effort into their tasks as well. The negative of hiring staff is that it is a lengthy process. A case will have to be made by the manager to upper management to prove there is a need for new staff. This would not take too long, but the human resources process may take a bit too long for immediate help. Human resources are responsible for seeking out eligible employees that line up with the job description and specifications. The job description is comprised of the job duties, and the job specifications include skills, education, and abilities needed to complete the job daily. After several applicants are matched, selection interviewing will start. Selection interviewing is an in-depth session with the applicant to further investigate them by comparing their resources so a hiring decision can be made. Once the selection has been made, the onboarding process can be started, where there are orientations and training that needs to take place before the employees can start their duties on their own. So the best solution short-term would be to shut down the X-ray department to help in other departments, utilizing staff that are already employed to help in other higher revenue. Making modalities can solve many problems very quickly. X-ray income would not hinder the budget too much and can alleviate stress on other employees. And it is budget friendly. Since this solution was mostly focused on staff and processes as recommended by Liebler and McConnell in 2020. This solution also offers safer and better patient care. There will be more eyes on the patient, meaning they can be monitored more effectively. The patient may not have to wait as long for other technologists to bring them back for their studies. It will create a better flow between patients. Even though this is the best short-term option, there must be a solution that is going to be long-term. As this plan is implemented, there will be a process started to hire more PRN staff. Since this process is a long one, utilizing existing staff while onboarding others will help build a more permanent solution for the facility. As far as implementation goes, using the management function of controlling, taking corrective action is needed to obtain the facility goal of aiding staffing shortages. This solution will be implemented as quickly as possible, so there is little time between knowing the staffing issue exists and beginning the rectification process. Solution uses a rapid improvement cycle that makes for a short-term implementation time with more improvements made at the same time. The timeline for the short-term solution is 1 month to allow for adequate time for result collection. If it is working, the short-term solution will be continued until PRN staff can be obtained and trained. So the best solution as far as feedback is concerned, the solution can be measured easily. Management will keep a close eye on the changes within the facility to ensure the selected plan is helping to rectify the staffing issues. This monitoring will be completed by weekly meetings with staff. It's going to ensure burnout is not occurring. By meeting with staff, gauging how they feel is a big tell if they are being overworked and overwhelmed. It will be up to the staff to be as honest as possible to not obscure the results. A close eye will be kept on reports of production units per tech and will help better visualize if the change is working. By using a participative management style, it can help the performance of this improvement initiative. There is a chart obtained from the first month of implementation compared to the previous month. On average, in the previous month before the implementation, there was 1 tech per 240 patients for the month. Post-implementation, there are 1 tech per 182 patients. This evidence is showing that the short-term plan is on the right track for helping with technologist burnout related to understaffing. This will continue to be implemented until more PRN staff can be hired and oriented. In conclusion, COVID-19 has affected the Riverside Diagnostic Center by reducing staff. This reduction in staff has made employees bear more work than pre-pandemic times. Mandatory quarantines, call-outs, resignations have all contributed to understaffing. There will be temporary solution of using lowest income departments as aids for other modalities that bring in more revenue. So far, the solution is working, while the long-term solution for hiring more PR employees is carried out. With eventually hiring more employees to keep on hand, this will prevent staff burnout by keeping understaffing from happening again. Thank you.